The introduction of tablets into the hospital has created a mobile, high-touch surface that we need to pay attention to. I consider high-touch surfaces anything that we touch very frequently in the healthcare setting, and it can be something that a patient touches or healthcare personnel touch. Healthcare-acquired infections are an important issue that we pay attention to in hospitals, and we do have to remember that at the center of this are patients. These are our patients that we need to take care of and keep them safe. The exact number of patients who get infections in the hospital setting is really unknown. The number we hear a lot is about 1.7 million to 2 million patients a year in the United States. It's based on some older studies about 20-some years ago, but we think the number is probably somewhere around that. Clearly, getting an infection in the hospital continues to be a risk to patients. The deaths around the patients who get hospital-acquired infections, the number too is often touted as about 100,000. So it really is imperative that we do everything to prevent them from getting an infection to start with. Organisms do linger in the environment, and whether it's in the hospital setting or the community, the bacteria don't know that. They don't know what surface they're on, but they will stay there and they will linger and live there. For some bacteria, some that cause some pretty significant infections like MRSA, which a lot of people have heard about, it can be hours to days, and in some surfaces even weeks. There are viruses that live on surfaces for a long period of time. There are other bacteria as well. So one example around hand hygiene is having a lot of dispensers available to them at the place where they need to use it, using alcohol-based hand rubs so they don't need to go to a sink and use soap and water. Going forward, I think that we're going to begin to really recognize that tablets are a piece of medical equipment in the way that we think of stethoscopes, blood pressure cuffs, and a variety of other things that we use on multiple patients. Most of the focus so far has been on the use of a tablet by the medical practitioner for charting, for looking up medical records, doing searches, that type of thing. But more and more we're going to start seeing use where the tablet is actually given to the patient. Although tablets are used a lot in the home setting, it's a little bit different than in the healthcare setting. In the healthcare setting, there will be organisms that the tablets are exposed to that we don't commonly see in the community, such as antibiotic-resistant organisms. So if one is using their tablet in the hospital setting and then you want to take it home, use it to do work, to give to the children, to play video games, that kind of thing, then you want to clean and disinfect it before you take it out of the hospital and take it home. In general, you should follow the manufacturer's recommendation for your particular tablet around cleaning. However, most manufacturers will recommend that you not expose a tablet to liquids or to sprays. And so that leaves us with a conundrum in the healthcare setting around how to disinfect tablets, since most of our disinfectants are liquid-based or sprays. Recent studies have reported the results of random inspection and culturing of mobile devices, both inside hospitals and in public settings. One study found that close to 40% of patients' personal devices carried bacteria, while 20% of healthcare workers' own devices were also harboring pathogens. How often you clean and disinfect your device plays an important part in combating the proliferation of pathogens. Be sure to use appropriate methods of disinfection that adhere to your workplace's policies, regulatory guidance, and instructions from the manufacturer of your device. We need to remember that there are infections in the community, and a lot of the principles and practices around preventing transmission of organisms in the hospital setting also translate in the community into our own personal lives. That means good hand hygiene, good personal practices about cover your cough, cover your sneeze, don't go to work or go out if you're sick, and also not sharing personal items.